Right. So far, we have a number of reports on our website. We're putting them out almost daily at this point on a whole bunch of different things. And a lot of them sort of are right at this intersection of economics and COVID-19. And part of the reason for that is we're in this unusual situation where we have an economic crisis that is critically dependent and actually caused by a health crisis. So all of us who are economists have to deal with the reality that, first of all, the rules are a little different than what we've seen in prior recessions. And the economic crisis can't really get better without effective solutions to the health crisis. And so what we've seen when we looked at sort of some things that, I think surprised me, last week, a lot of unemployment numbers came out. And, every week there's the unemployment insurance numbers. But what came out last week was our first really detailed government jobs report, which is sort of the data sets that tell you a lot more. The thing that struck me the most about the employment situation last week was just the breadth of the losses. I mean, the data, we all know restaurants, accommodations, like hotels, airlines have been hit hard. But what we're actually starting to see already, and the data even that's been released is still lagging a little bit, which is something important because it's not like government data sets come out instantly. The COVID cases come out every day, but the economic data doesn't. And so, but seeing the breadth of sort of this is starting to creep into so many more sectors beyond that, in terms of manufacturing, in terms of, just the healthcare sector, there's actually been some pretty big hits, which is sort of an interesting point, partly because there's this weird split in the healthcare sector. You have the emergency workers, the COVID workers, but then you have a whole host of others, dentists, elective surgeries that are done at sort of ambulatory centers where there have been job losses. And so it's really interesting there. And then in terms of the intersection of the two, as we've been sort of following it, I think the biggest things to sort of keep in mind, this is a very complicated, even data problem. Because what you have going on is you have reports on a daily basis of number of new COVID cases. But those are critically related to the number of tests being done at any point in time. So the problem there is the number of tests are going up and down, just like the number of cases are. And if you don't know what's going on with that, that could really skew the results. Are you getting more cases because you're doing more tests? Or what if, in fact, the number of tests are going down and you're getting more cases? What does that mean? Second big issue is who you're testing is a highly selected sample. This is a classic example of what economists, statisticians call sample selection. Who's the most likely to get the test? Someone who's showing symptoms. Okay. But what does that tell us about the broader population? Well, it doesn't tell us very much about the broader population. So the third big thing I would say that we've noticed is, averages always lie. I'm not a big fan of averages. And we talk about, well, the number of cases in the U.S. are flattened. Well, if you take New York City or New York out of that, that's just not true, right? Cases other places are still going up. We're still in the upswing. As you start to watch different locales opening up the country in different paces, we have what an economist would call a natural experiment. I'm not happy we have it, but from a data perspective, it's actually really interesting. We should be able to see, if we're thoughtful about it, exactly how the opening of different locations will square with the number of cases. But it's not instantaneous, okay? It's not, they opened yesterday, what happened to cases today? That's just lazy statistics. It's at least with about a 2-week lag, right? And then you still have to keep on top of the testing. So what we're trying to do is we're developing sort of a series of models and papers where we're going to actually try to assess the reopening and see what's happening with the cases. And so to me, that's what's really interesting. That's the really big ticket question right now, I think. So those are just some of the insights that we've noticed. And again, we're trying to educate people about different things and just make it as simple as we can.
Thank you so much for checking out this clip from the Data Talk podcast. To watch the full episode, you can either go to the Experian blog. The URL is experian.com/datatalk, or you can click on the link, which is found in the description of this video.